Hypospadias.
Mohit?
Mohit, sir.
Yeah,
Are
you
you
can start.
ready for your case presentation, doctor?
Yes, sir.
What is your case?
It's a 6-month hypoparesis repair, sir.
Have you seen or done a case of hypospadias repair in your
Yes,
career
sir.
now?
Yes, sir.
Oh, very good. Excellent. You are from Bombay, is it?
Yes, sir. JRH, Jagjivan Ram Railway Hospital.
Very good, very good. So, good thing that you have seen that. So, you must know how it is done and what anesthesia to be given. What is the anesthesia you gave for the cases that you saw? Hypospadias repair.
Sir, it's under general anesthesia with a caudal block, sir.
With a caudal block. Why not just do it under caudal block alone?
Sir, because of that pain component, sir.
No, when you give a caudal block, pain is not there, isn't it? So why you want to
Yes.
give general anesthesia also?
Sir, it's a pediatric case and it's patient are not cope.
Yeah, they will be, if we are keeping the patient conscious, they will be scared of the environment.
Scared of
Because
this
they have what
procedure.
is called separation anxiety, and
Separation anxiety, sir.
the new environment will make them scared. Okay, so they will
Yes, sir.
start crying even if they don't have pain. Okay,
Okay.
so to keep the patient quiet, you require some sort of sedation or general anesthesia along with caudal. Caudal alone may not be sufficient. Whereas you do so many surgeries under spinal or epidural in an adult patient, isn't it? So
Yes,
you
sir.
are able to, they are able to comprehend, and you can tell them, don't move, things will be all right. Surgery will be for about an hour or so. You will be back to the room. If you tell them, they can understand. Whereas children, they will not be able to understand that. So what is the ideal age at which this surgery is to be done? I have given the case scenario, a 6 months old baby for hypospadias repair. Is it the correct age to operate on that?
No, sir. Actually, the age is between the 12 to 18 months of the age.
18 months of age. Why you want to wait the child to grow a little bit?
The penile material will be adequate for the repair.
Adequate. Tissues will be more, availability of tissues will be more. Okay, right. So what are all the options of anesthesia you have along with GA? Is it always necessary to give only caudal block?
No, sir. Actually, for a general anesthesia, we can give, if the surgery, surgeon is planning for the buccal mucosa repair, then we have to give the endotracheal tube. Or if the procedure is not under the buccal mucosa is not required for the repair, then we can go through the IGL or LMA.
So what are all the types of hypospadias you have seen?
Or,
It can be present at the glandular, glans penis
Yes,
level.
glans
It's
penis.
then called glandular hypospadias.
Glandular.
Or it may be present in the shaft of the penis. Okay, then it is called
And
mid
there is
shaft or a proximal shaft hypospadias. Okay, this is nothing but an abnormal opening in the urethra, which is communicating to the skin. Okay, why do you want to correct the hypospadias? What are the reasons you want to repair that?
because it's initial stage, it's scared. The parents are more scared about that, and laterally, in once the patient, the pediatric child is grown up, then it's anxious for that patient because of that dribbling and
It
dribbling.
will not be having a normal stream of urine.
Normal
It will
stream.
be soiling the dress, isn't it? Because it is coming
Yes, sir.
from the undersurface of the penis. It may not go straight. So it may
Yes, sir.
invariably soil the dress, undergarments, and patient will feel very
Uncomfortable.
shy and unhappy with that. And that may cause recurrent urinary tract infection. And this will give an abnormal shape to the penile shaft also. And as they grow older, erection also will be affected because the tissues will hold the corpus spongiosum, corpus cavernosum, all these structures will be held back, so a proper erection will not happen, which may cause problems in sexual intercourse if they grow up to the adult level. Okay? So that is why it is usually corrected The child is about 12 to 18 months old or a little older also. So can this surgery be done under penile block?
Yes, sir.
When will you resort to penile block? The entire mid shaft or the lower proximal shaft hypospadias, can it be repaired with the penile block?
No, sir. Actually, it's a distal or a distal.
Very distal portion, very small
Plants.
hypospadias, very close to the meatus,
Plants.
normal meatus. If it is there, then that can be managed with a penile block. How do you give a penile block?
Sir, penile block is given by stretching the penis and by palpating the lower border of the pubic symphysis. And at that point, we can direct the needle. If it stuck with the bone, then just go downward inferiorly to that, and we will feel the loss of resistance. That's a Buska fascia.
Bucks fascia.
Bus
Okay, very
fascia.
good.
It's
So
usually
what
at
nerves
the
you
11
block
and-
by this?
Sorry, sir.
Which nerves you block by this dorsal injection?
Sir, dorsal nerve, sir.
Dorsal nerve of penis. Okay,
Penis,
it's called
dorsal
dorsal
nerve,
nerve of penis.
Penis,
Okay. So is that alone sufficient for proceeding with the surgery? Will it block the undersurface or ventral surface of the penis?
Yes, sir. Require the uh, under surface of the penis also.
You have to go. What is the ring block?
Ring block to give the around the penis.
Around the base of the penis,
At the root
you
of the
give
penis.
root of the penis, you give from 9 o'clock, 12 o'clock to 9 o'clock, 12 o'clock to 3 o'clock, then combine the 9 and 3 positions, then you get a ring block where you cover all the nerves and you can manage that also. Caudal, how many caudals have you done?
Sir, 3 to 4 cases, sir.
3 to 4 cases. Which position did you adapt the baby?
In
Right lateral or left lateral?
In lateral position with left lateral position, sir.
Left lateral with the leg flexed or kept straight?
With knee and knee flex.
The thighs flexed nicely on the abdomen.
Abdomen.
And what are the landmarks you palpate before you do the caudal block?
Sir, iliac crest and then palpate the posterior superior iliac spine, and then with the thumb and the index finger, with the thumb and the middle finger, then palpate the sacral hiatus with the index finger.
Okay. What is the guarding anatomical landmarks for sacral hiatus?
Sorry, sir.
The bony landmarks to identify
Sacral
the
cornea. Sacral cornea.
Sacral cornua. Okay.
Sacral
Both
cornea.
sides you have the sacral cornua. Okay.
Sacral cornea.
What is the angle in which you insert the needle?
At the first time, we will go at the 45-degree angle, and then we will about parallel to the skin. Once we cross the superior,
okay.
once we cross the sacrococcygeal ligament, sir.
Okay. How do you know that you are in the caudal epidural space? What are the confirmatory tests you can do to identify that you are in the caudal epidural space?
Loss of resistance, then loss of resistance to saline, loss of resistance to air.
What is whoosh test?
Whoosh test, sir.
Placing the stethoscope over the
We can hear the sound by auscultation.
auscultate.
You can inject the air
Remove
1 to
the-
1.5 ml into the space by a sudden push of the syringe and auscultate over the sacrum or a little higher up. You can hear a push sound because of the travel of the air. What is swish sound? It's the whoosh, SWOOSH, swish sound.
Whoosh sign, sir. With saline, sir.
With saline, yes. If you use the saline, it becomes swish sound. If you use air, it is a whoosh sound. Okay.
Whoosh. Yes, sir.
If you do an ultrasonographic guided block, what are all the structures you will try to see?
Sir, firstly in the in plane and out of plane. In the
Out of plane.
with out of plane, we will see the sacral cornea and the sacrococcygeal ligament. It will look like the fog eye appearance. and sacral posterior surface.
What is the advantage of using ultrasound instead of the blind anatomical landmark techniques? For a caudal block in a child, what is the advantage of using ultrasound over anatomical landmark technique? What structure you can easily see and avoid a major complication?
The thecal sac.
You can dural sac. You can see the dural sac. You
Dural
can
sac.
see the deposition of the local anesthetic under your vision.
Yes,
Okay.
sir.
Very good. Okay. So I'll just show you some PowerPoint presentations on that. And of course, this is all. Are you able to see this? Okay. So this is all about I think, thyroid.